Welcome to your medical unit huddle for February 25th. I'm Ricky, your nurse manager. For patient experience this week, we're going to talk a little bit about some housekeeping issues. One is the 2RN skin check. We've been doing it. That kind of came out with the Unit Practice Council about a month ago. And just remember that you are supposed to do a 2RN skin check with any new admission, any transfers from other units, and any patient who is coming back to the unit who has been off the floor for greater than 4 hours. Usually it's your dialysis patient. So give them a good look over, and then the nurse, the primary nurse and a second nurse can do the skin check with you. So make sure that you guys are documenting that in Epic. I think there's some information that is going out about that, which then leads me into the turn teams. We do have a turn team work group that will be meeting on Thursday, the 28th, to revamp our turn teams, kind of zhuzh that up a little bit. With bedside report, I did get a couple of RLs regarding IV solutions or antibiotics, things like that, that are hung but have not infused. So please make sure that you guys are checking IV fluids when you're doing your bedside report, that you guys are looking at the fluids, and if you notice that something is clamped and it's full, that you guys are addressing that in the moment. So just something to think about there. And then patient information sheets, not really sure when those disappeared, but over the last week or so when I'm rounding on patients, I've noticed that the little pockets inside the room are empty. So please make sure that you guys are filling out the patient information sheet. It may not be important to you, but it's important to the patient that we're filling those out, that they know their plan of care, they know what the expected discharge date is, and what we're trying to do to get them home, whether it's weaning oxygen or having a bowel movement, that kind of thing. So please make sure that you guys are filling those out and sharing those with your patients. And then flu restrictions. I've had a couple of people ask me about having kiddos 12 and under on the floor. There is no restriction for our unit. Those are only for the ICUs. We did get that verified with Emily Thorpe, that there are no flu restrictions for the floor when it comes to having kiddos on the floor 12 and under. So there, now you know. For innovation, so you may have seen these little bad boys floating around. These are the one-piece gauges that I have ordered. So you know, you have your patient, of course this isn't a disposable one, but your patient has a disposable cuff or even a reusable one. You can just snap this onto the cuff and then take the blood pressure, okay? Especially with all of the VISIs, if you you know, need to take a manual on a blood pressure that you just don't feel like is correct, you can, again, without having to take the cuff on and off the patient, you can just snap this right on. With Visi, you guys are doing such a great job putting all the patients on. We did actually get a little kudos for Jenny and for Kari. It says, we wanted to recognize you for ensuring your patient was on Visi because of your hard work, dedication of making sure as many of your patients are on Visi as possible. You and the VHC were able to prevent further deterioration of one of your patients. Thank you for keeping our patients safe. So again, it is a surveillance device. It does take vital signs, and thank you for putting your patients on them. Got my little list. Teletracking. The dark mode feature, that when they did the upgrade, if for some reason it went away, they are aware that that feature is off. So when they do their next upgrade, don't ask me when, they will put that dark feature button back on there. So please hang in there as we wait patiently to have that contrast put back on the board. Then we have type and screen is now going to need 2 RN initials. So when you are collecting a blood specimen for a type and screen, you do have to have a 2 RN initial on that lab label. Also, during the patient's stay, they need to have 2 type and screens, which means that they need to have they'll have one in their history. I believe you can look back at that in the labs, and then a current one. So there'll be more to come on that, so just know that that is coming. And then, let's see, staff recognition. Sarah Rash is joining us. She is a full-time night shift PCT, and we have lots of orientees from Greeley and from 5 South, so welcome. So glad to have you here on the medical unit. Let's see, that is all I have, and of course I always encourage you to subscribe to our MCR Medical Unit YouTube channel, and you guys have a great week.